Which is the other stroller view.
Good evening, everyone. Thank you so much for being on the call tonight. We're pumped up. I'll just tell you that. We're pumped up because we know what we have coming. We know what we have today. And so we wanted everybody to hop on tonight because, as you know, every Tuesday night we try to give you nuggets that will help your business to go quicker so that you can do the things that you want to do. And I'm going to briefly tell my story really, really quick. I've been here for 2.5 years. I came here just because I wanted to make some petty cash because I laugh and say, I'm a granny and I just wanted some play money. So I started being here with the coffee and waited around until we got the fix. And when we got the fix, guys, my whole life began to change. I literally went from uh, wanting to make an extra $5,000 a month to play with to literally making more than that every single week. And this just started in July. So when you have the right mindset and you're able to identify the quality that we have here, the compensation plan, I've been in the industry 35 years. This is the easiest compensation plan that I've ever had. And so I laugh and I say, you know what? If I can do it at 70 years old, I promise you, every single one of you can do it at whatever age you are because it's simple. It's duplicatable. You point and click and duplicate, and that's how simple it is. But tonight we wanted to bring everyone on because we have a brand new product that we are launching. And here, no, we don't have it yet. It will be at Vegas. But here's why we're excited. We had this product before, but we have been trying to get it here for over 2 years. And we just got things signed, sealed, and delivered. So we're going to hear about that tonight. And I'm going to introduce Jackie from Australia. She's a double diamond. And she has worked direct with the formulator, who has been nominated twice for a Nobel Prize. So, guys, we are at the right place. I can see people's lives changing every day, but it's because of the quality of the products that we have, and it's exclusive. So, Jackie, I'm going to turn it over to you because you've been working direct with Dr. Ahrens, and if you would just kind of fill us in on what we're getting ready to have.
Thank you, Karen. I will say this, I'm not quite sure. I do live in Australia and I've been very fortunate enough to be in the presence of such an esteemed, who now has become my best friend and my business partner, Dr. Joseph Ahrens. And I would not be here without this man. And I do not say this lightly, but I also want to pay credit where credit is due. When we were looking for a company, we've been with Dr. Ahrens for quite some time. I was with 2 companies with him. But to come into MPG came in on the hands of Karen Ford. So Karen Ford had a very big role in trying to initially start and get this ball rolling. And so it takes a village to raise a child. And it has taken a village to get to this stage to where what I'm going to share with you tonight, because for those that do not know anything about Dr. Ahrens or about this formula, what you are going to see, I have got about 5 or 6 slides that I am okay for us to actually share. I had to have a look through to make sure, because what I want you to understand, when we went looking for a company, because of previous experiences and what we wanted to make sure that we had something that was really stable for us and to ensure that we weren't going to have any problems going forward. We knew that we needed a place that was going to be safe, and we knew that we had an audience that already needed the product. And it made us so sad, to be honest, to have a product that had such a huge impact on people's lives, thousands of people, like literally thousands of people, and then not to be able to help them because we didn't have a home has been devastating. And so to be able to now, on the weekend, at an event up in Queensland where Randy and Cathy were, and also our CEO, Mr. Yap, they were also out for an event. So just up on stage, we were going to explain the partnership of bringing in this company in with MPG with this product. And we weren't sure if we were going to announce what the product was and what the name of the product was. So to be able to do that, we are now running around with our pants on fire. So I am going to share a couple of slides with you, which I think will put it into perspective on where we're at. And I honestly can't say enough to you to say just how proud I am of this team. Forward Team Training has been at the forefront of this, and I will say this not lightheartedly either. I say it with nothing but pride to be able to have something that has been so impactful with the Forward Team Training behind it, with Karen, with Jamie Dulaney, with Kendall as well. There's been many faces in behind this that have just done phenomenal things with this product of Dr. Joseph Ahrens to bring it into where we are in this present time. We've got so many people with passion and heart, but no more so than this man. I've mentioned to you before, like, he literally has saved my life. I'll give you a little bit of an overview of that later. But to be in the honour of this man, to have this person, Dr. Joseph Ahrens, to bring MPG, EMULIN 5, into our space has just been nothing short of a miracle, to be honest, because even this morning when I spoke to him, he said, "Are you really that excited?" And I said, "Are you kidding me?" And he said, "But we thought that it's happened before." I said, "But this is different." So when we introduced Dr. Joseph Ahrens, this product has been created by him. It is a patented formula, EMULIN itself. And when we look at it, he is a dual-nominated Nobel Prize scientist in 2015 for this formula, EMULIN, and also in 2016 for the cure for SARS, dengue fever, and Ebola, which is huge to think that this credible man has brought something so amazing into your hands. He has a doctorate. He's a former director of the Florida Citrus Board, where in actual fact he was with his former partner. They were actually looking for a weight loss product through citrus grapefruit. And they stumbled across this. They literally stumbled across the formula of EMULIN, which was a godsend for all of us in many lives as we went forward. He is the founder of his own company, ATM Metabolics in USA, and also ATM Metabolics Australia. I am going to give you complete transparency here so that I've spoken to Cathy and Randy Teinhardt and Mr. Yap. I actually own the company ATM International here in Australia. Dr. Ahrens is a partner with me with that. So this product falls in underneath that company. So I just want to make sure that complete transparency is there for you. Like, this is a part of my company with Dr. Ahrens. And yes, I am a distributor just like you. When we started looking at why we chose this company, like, what was it about it? Like, Karen came to us with it and wanted to bring this product in underneath, but 2.5 years it's taken to sign that dotted line. And it was through strong partnerships, deliver foundations that we can only be proud of, that has trust, integrity, and honor. And I want to actually just highlight a couple of things here because this is very important. And I want you to know we've gone above and beyond. Never before have any of Dr. Ahrens' products actually undergone these types of things through any company. So please know what you have with MPG is something extraordinary. So already we have TGA approved. It is done, a big tick. There is an AUSTEL number for that you will see very soon. Past the batch testing, we are undergoing that process. It's in progress. So once the product has been manufactured, that is a process to test for illicit substances. So it means if you're in the sporting space or you get drug tested at work, please know that through the 350 illicit substances that are placed in there, they will test it when they first get it, place the substances in, test it, then they have to be able to take them all out and they will retest it. So test 1 and 3 must marry up. If they do not, it does not pass. We need to do 6 of these in concession of each batch to be able to use the HASTA logo, but we are going through that progress. Halal certification for religious beliefs, to be able to take that into the world with that certification. This manufacturing facility that we're using in Australia is a TGA certified facility, but it's also a halal certified facility as well. We are doing stability certification. That is in progress as well, and also quality control. These two things go hand in hand. What do they mean? Never before have we actually had a product of where we've actually, imagine when you go into a pharmacy, if you go into any pharmacy or even a drug store where you might get supplements, none of them will go through this process. None of them. But we've chosen to go through this to make sure that we're going to provide stability when you get your very first bottle to when you are still getting product in 2 years, 3 years down the track, that your formula is going to be stable. And this is what stability testing is, and also quality control. So at no point in time are we going to be seeking out active ingredients that are not of the highest quality from when we first started and what we signed off on. We are so proud because we have an exclusive agreement with EMULIN 5 with MPG. So you are not going to see this formula anywhere else in any other network marketing company. We will not have any of Dr. Ahrens' other formulas in any other network marketing company. We have planted our flag here. This is the only network marketing company that we are going to work with. No one else. That is signed, sealed, and delivered in an agreement, and that is our choice. We also will not be able to see this formula even out in a retail market either. This is a formula that is exclusive to you. You have Dr. Joseph Ahrens on board, and you also have a dual-nominated Nobel Prize scientist, as I mentioned. So if that doesn't give you stability in what you have in this product, I'm not quite sure what will, because I've never actually had a company. I've tried before in the past to have all of these things provided for the end user, yourself, and nobody has been able to do that. When we look at into the TGA, this is something that takes a lot to get done, I'm going to say. So when you go searching, you can search around 24/7. It is public record knowledge. Go and have a look under the Australian Register for Therapeutic Goods, type in 477667 and EMULIN 5 will come up. Also, the permitted indicators are your marketing message. This is something that we legally can talk about that this product can do for you. So when we start and understand what it can do, you'll understand why we're so excited, because having TGA and AusTel number is such a phenomenal testimony to the credibility of this product to be able to bring it into your hands. I wanted to share this with you. When we start looking at how this product works, you know, it's an interesting product in regards to being the world's first carbohydrate manager, where we're chaperoning 33% of your carbohydrates through your body in 7 key pathways. These are the key pathways of what you're looking at. So starch to sugar conversion, glucose absorption, glucose tissue update, fat formulation, glucose homeostasis, insulin release, and insulin sensitivity. It stacks up to its competitors. So we wanted you to understand and know what this could potentially do for you through these 7 key pathways. And Dr. Ahrens will eloquently explain this in his scientific manner. Only he can do best. But also understand that you have a sugar controller. So when we start looking at that, we have a product that can cross the blood-brain barrier to be able to manage sugars as you absorb them. But also what you do have, when we start looking at what this man has provided, also got I want you to have a look at this while I go through this. You've also got a connection through your gut-brain axis as well. And I'll explain what that is about and when we get to the next slide. And we also have vitamin C through this product also. But I wanted to pull this in so you understand what you have got. Dr. Ahrens actually endorsed Fix. I know this isn't about Fix today, but I want you to understand how this fits into EMULIN 5. He didn't know that he was going to bring this product into this company. We were working on it. We hadn't signed off on it when actually he endorsed this product for myself to be able to share it with you guys, because he was blown away by what he could actually research and understand that the power of what Fix has and how well the synergy of the two products can potentially work together. So I want you to understand what you've got in your hands right now as a business. Go and share this product with Fix, even if you are new. Talk to the person that's brought you here, and then get prepared, because what's about to land on your hands when this product is launched with EMULIN 5, it gives you the ability of having a cutting-edge product by Dr. Joseph Ahrens. It has a synergy of flavonoids. These flavonoids come from the patent blend, and it comes from quercetin, myricetin, and chlorogenic acid. We also have included a probiotic in there, and we also have placed a vitamin C. So the probiotics combined with that synergy of flavonoids is going to give you a gut-brain axis, and it's also going to provide you with your daily dose of vitamin C as well. We do want you to say, because you're going to see remarkable things that happen. You honestly are. Like, there's thousands of people, and you're going to hear a few testimonials today that we make no claims at all to heal, cure, or fix any medical condition, but we do talk about assist, support, and managing symptoms. And when explaining your thoughts, that we want you to actually utilize those words, because as we go through this process and you understand what you have in your hands, Dr. Joseph Ahrens has brought you a cutting-edge product. It is a patent blended product nominated for a Nobel Prize in 2015. It is the world's first carbohydrate manager that chaperones 33% of your carbohydrates through your body through that 7-pathway system, controls sugars, crosses the blood-brain barrier, has a gut-brain axis connection, provides you with your daily dose of vitamin C. It doesn't get any better. Topping it off, why we've chosen MPG and their commitment to us as being product providers, that they are going to provide all of those certifications for this product. Know that you have something that is not just 5-star, it's actually 6-star. Why do we choose EMULIN 5? Because there's 5 active ingredients in there. I think it's a very clever name that the company has come up with, but just know that you are in good hands. I do want to say to you, in regards, because I know you've got some testimonials, I want to just say to you, it's not my place to share my testimony here at this time, but I'll say to you, it's changed my life. It saved my life. I have letters from my doctors over the years, and they're going to rewrite a new one, an up-to-date version on where we're at. What has this product done for me? Allowed me to get off of 14 scripted medications and to be able to live life well. But I also had some missing areas in there that just weren't quite supporting and navigating me to where I needed. I started taking Fix nearly 6 months ago now, and I'm wanting to piece this together for you so you understand what you already have and what you're about to receive. I've been in for surgery twice since taking Fix, and my surgeons of 30 years, I'm in there every 3 months with the same surgeons, said to me they've met Dr. Ahrens. He's been and seen them because, he was blown away by what my journey has been with my health and what these surgeons could see internally in my bladder. But what they've noticed with Fix, and they said, something's changed again for you, like what have you been doing? And I said, well, I actually have started taking another product, but it was only 7 weeks after I started. I said, oh, okay. And they said, well, what is it? And I told them about Dr. Ahrens researching it. Wasn't his product, but he told me that he felt that it was good for my system. So I believed him. Going forward 2.5 months, I went back into surgery again, and that was just before Christmas. What Dr. Lynch could tell me, and also Dr. Green, post-surgery, and they said to me, there's nothing wrong that we visually can see with you. And I could feel it. I still have to self-catheterize. The functionality of that is still there, that I need to do that. But any neural pain that I was having, any of the gastritis symptoms that I was having, from fibromyalgia to peripheral neuropathy, all of those things that were happening for me that I just wasn't quite getting, going into surgery a week prior, it would be a case of I had no bladder control. I'd go to the grocery store and I'd be standing in a puddle of wheat. That's all gone. And even Dr. Ahrens mentioned to me, he said, you're not complaining. He said, going into surgery, he said, what's going on? He said, you would have been, whining by now. And I said, well, it's just not happening. And I wasn't even aware of it, but it's all gone. And so I'm kind of at the stage of thinking, do I even need to get it done? But I'm too scared not to, because it's been 30 years of going in every 3 months. But what they can tell me, this synergy of these 2 products, so what you have in Fix is phenomenal. But what I'm experiencing, my husband too, with the combination of the 2 and the synergy, is life-changing. But if I want to give the credibility back to EMULIN itself and EMULIN 5 and what you have, I've seen so many people that have just changed lives. I've seen them where they've been on a walking frame. I've seen them where they have had so many different symptoms that are associated to inflammation. So this is a product, as I would affectionately call it, an inflammation assassin. When we are controlling sugars, we are then depriving inflammatory levels or inflammatory conditions of being fueled by sugars. When we are chaperoning 1/3 of your carbohydrates through your body, carbohydrates are links or units of sugar. So then therefore we are also depriving inflammation from being fueled by sugars. put it together on top of a probiotic, and you've got that gut-brain axis of where the brain is stimulated by what's happening in the gut. So then the gut becomes healthy, having good, friendly flora placed back into the body, plus having your daily dose of vitamin C. Combined it with Fix, you now have a product that also, through thermogenesis process, is warming up visceral fat, mobilizing sugars and fatty acids, releasing trapped toxins, that we are noticing that inflammatory conditions are benefiting from it. So can you imagine our excitement knowing what we have, that you not only have one stellar product, you now have two. What I do want to share on here too, and I know that this is true and factual, this company is also doing the same for Fix. We are nearly TGA approved. They are going through those other certifications here in Australia as well, because we will be manufacturing out of Australia for part thereof Fix too, and they're going through those same certifications. I want to enforce this to you, if you would give me the liberty to say here, your company that you have, our company, I haven't ever had a company that has done this at all. And you go into a pharmacist and you will never see a pharmacist that has done any of these tests other than the stability and quality control, because they have to. But outside of that, you're not going to find it. So please understand, as we go forward, there's a few other key things I wanted to share with you. When we release this product, we are going to have all the education for you. You will have protocols to follow so that you'll understand what's the difference between the previous EMULIN that we had and where we're at now. You will have frequently asked questions and answers that you will be able to share and understand. We will have a PowerPoint for you, for the general public to be able to take and use. We will provide it to you so you can go and share it. We will ask that you don't change it, but we want to give you as much information as you can so that you stay compliant. Anybody that actually has, on the compliance note, any old information that you've got on these previous products of Dr. Ahrens with EMULIN, please try not to circulate them, because it's going to be false information. We want to make sure going forward, and this is why we've partnered with MPG, that we're trying to make sure that we provide you with an absolute amazing product, that when we do launch it, you're going to have the correct graphics that are compliant, that are going to protect this man, Dr. Joseph Ahrens, and his legacy for his family that he has worked so hard for. It's going to protect our company, it's going to protect the product, but it's going to protect you. Because as you take this out to people and you share it, people are going to trust you. And now you should be able to know that you have the trust in what you have by what I've shared with you, by what this company is undergoing, and they've agreed to do for what our needs were to bring this product into this company. So I'm pretty excited. I don't know how you feel about it, Karen or Jamie, because I'm quite happy to share it across or jump across to others, because I know for compliance purposes we can't really share anything else much than what I have. And I hope that people just get as excited as what we are.
Thank you, Jackie. You can go ahead and turn it over to Jamie in just one sec. But what you heard tonight, no, you don't have to know all of that to go market the product. But once you have that product in your body, you're definitely going to know why we're excited. And you're going to be equally as excited, because the link between Fix and EMULIN, to me, has been a game changer. I love when Jackie said, add your EMULIN that you have, because that's all you have. And by the way, Jackie, since you are a part owner in the Australian, maybe this team can get product first, do you think?
I will try.
That would be perfect. But thank you for sharing everything. Thank you for going over all that, guys. We're just launching this, so we want you guys to be educated on the power of what it really does. So with that, I am going to turn it over to the one and only Miss Jamie Dulaney, who I have got to work with for, oh my gosh, Jamie, I guess 20 years. And she is absolutely one of the most incredible human beings, and a good friend, and an amazing leader. She does all of our 14 websites, our training site, everything. She loves our people. She's a member of the tribe that she sticks up for us all the time. And Jamie, thank you for being here. And I'm going to turn it over to you.
Thank you so much, Karen. We all love you so much. You know I do. And, I want to give credit where credit is due also. And that is to Karen and also to Jackie. These are two incredibly gifted women. And we're sitting on this team. Everybody on this team is just spectacular. We hear from so many of our team members all the time, and every person is better than the next or as good as the next. So we are a team of inspired, motivated people, and we're happy that you're here. Jackie, of course, had a life-changing experience with EMULIN, and she never gave up on it. She, even though it's taken over 2 years to find a home for it again, she persisted with that. She's made sure that everything's in place. Some of us have been buying it on the underground market, like me, and I do agree that it is better with Fix, and Fix is better with it. And so I have a long story to tell about that. But before I do, I just wanted to thank everybody, especially Karen and Jackie and Kendall, who does so much for us. And for each one of you that come here, that you're building a team here, we love you. We appreciate you. We are one, we are one. And that's the way we roll on this team. We don't roll with, who's on the top. We're looking down to the brand new person that just joined and trying to lend a hand, trying to build them up, pull them up. Come on, let's go. Get up. That is what we do here. And we're just so happy that you're all here. And if you're here tonight and you're not a member of this team, look no further than this team. Whoever invited you to this Zoom tonight, know that not only will they help you, but we all will help you. We all have different things that we help with, but everything that you need is right here on this team. So now I want to ask if Cathy Gregory is on. I want to bring Cathy on. Cathy has an amazing testimonial of her daughter with EMULIN. And Cathy, after you get finished, if you would put it back to me, and then I'm going to share my story with it too. So Cathy, are you here?
I am here.
Oh, okay. Thank you, Cathy.
I'm going to try and use the proper verbiage, Jackie, making no medical claims. And this was a few years ago. So my daughter now she's going to be 30 this September. But when EMULIN came in with our last company, Sarah struggled from the age of 7 for about 16 years with ulcerative colitis. So when we were first introduced to this chronic illness, I had no clue. What do you mean it's chronic? What do you mean it's a lifetime? I had no idea. And we mostly listened to the doctors. She was on very many pharmaceuticals in her 16 years of suffering with that disease, prednisone many times. And she got to the age of 23 and she had to have an emergency surgery because her liver was failing. And through that whole process, we were looking at natural products, but we still weighed heavy on her not suffering. So we were looking at all these immune suppressant drugs that her body was going through every 6 weeks on intravenous, and her liver was failing. And so when she was 23, they removed her large intestine. And then we still hadn't known about EMULIN. But during that first year after her surgery, she had a lot of blockages. And if anybody knows about that surgery, what they do is they put a part of your small intestine outside of your body, which is called a stoma. And because of scar tissue, it kept plugging up. So she had 2, I think, reconstructive surgeries that didn't work. And then that, I guess it was mid-August, EMULIN was in the background without labels, and the CEO of the company shipped us 2 or 3 bottles for Sarah to have right after her surgery. And she lived in a mountain town. If anybody knows Alberta, Canada, she lived in Canmore. And within 7 days of her surgery, she was back on her bike, riding on a bike trail between Canmore and Banff, Alberta, which is about a 20-kilometer ride. And within a month, she was standing on stage in Florida with that company, talking to people about how much benefit she got from that product. So not making any medical claims, but the healing that she received from that product was amazing. She is off all medications, so she actually doesn't take, she lives really clean. She's living on the island, but I can't make any claims to that product except for, like Jackie said, I think it saved her life. Back to you.
Thank you, Cathy. That is such an amazing story. And, you know, this product truly does have the ability to change so many lives, because we simply cannot get the nutrients that we need out of our food. And, you know, this product has some compounds in it that puts back in what our body needs to function correctly. I'm going to tell you my story. And again, not making any medical claims. But I was several years back getting dizzy all the time and sometimes feeling like I was going to faint. And so I found out I had a gluten intolerance. And so I started managing that with food, but I was still getting the dizziness. And then I was introduced to EMULIN at the company we were all with before. And as soon as I started taking it, all of that dizziness just stopped, like day one. I mean, I was getting dizzy every single day. It's like, you know, my body, I couldn't like go too long without eating. So I was a slave to having to eat every so often so that I wouldn't pass out. And when I started incorporating EMULIN, I didn't have to do that anymore. It freed me from having to have a snack of peanut butter or whatever. It taught me a lot. But what I did was I shared that with my dad. And my dad, he was getting dizzy all the time too, and very old. And he was on some medications at that time. And I introduced him to this product as well. And he started taking the product 2 in the morning, 2 at night. And his doctors started commenting that you don't need this medicine anymore. You don't need that medicine anymore. His arthritis went away. At the end of the day, he was off of all medicine. And all he took was what he called his medicine, which was EMULIN. And when my daddy, he accidentally fell down and broke his hip. And he did not recover from that. But up until the day that he passed away, he was still a very healthy man. He did not take any medication. He did not use a walker or a cane. He was still driving until his 95th birthday, when the insurance wouldn't insure him anymore. And that's the only reason. So his focus, his mind was still there. And when my dad did pass away, and later I was going through all of his clothes, in every one of his suit pockets, his coverall pockets, anything that had a pocket, I was checking all the pockets. Every single pocket had a little stack of my EMULIN business cards in it. My dad was ready at all times to share this product with everybody. He'd bring it to church. Everywhere he went, if he was sitting out on the front porch, just watching the traffic go by, he was ready to share EMULIN with anybody. He called it his magic pill. And I know that this product, I feel like in my heart, this product extended my dad's life, gave him more quality of life. He did live to be almost 97. And so this product has a place in my heart. I still take it. I had stocked up on it for him because I didn't know he was going to pass away. So I have a bunch of the other formula here that I still do take every day. I will also tell you that even during that thing that we all had to go through a few years ago. Me and my family, we were taking this product and none of us got that. So I think you know what I'm talking about, that sickness that everybody was getting. And I think that it played a part because it's got quercetin in it. And this is my own personal testimony. I'm not making any claims, but this product, it is just phenomenal. And I'm so glad that it came back to us. So that's my story. I think that's all the testimonials we have. Karen, do we have anybody else?
I don't think so, Jamie, if I want to spoke
Okay.
to Karen before, but what I wanted to say to you for people, we breezed through what we could give you. So if you're wanting more information, technical information, come on to the other calls because we can't record what we're sharing. We'd love to. So if you want to know more on the technical side of things, please jump over into those and that will give you an understanding on exactly what you do have. I personally just want to say, and I know Karen will probably top this up on top of it. What I saw Cathy's daughter go through was life-changing when you have something like that. When you have something in your hand, and Jamie and your dad, when you're a daughter, when you're a sister, when you're a mother and you're a grandparent, and you have no hope, that everything is just, you're looking at a wheelchair, you do have 14 scripted medications and there's nothing else. I had 8 chronic conditions at that time. I had nowhere to turn. I didn't want to be here. And when you look at where I was at, and I've got a lot of my family on here, that my EMULIN family that have become my family, that have seen that journey. Spread hope and give life a smile. You need to share this because I've seen thousands of people, their lives have changed and I would not be here without it. And that's why I've just been so passionate to make sure that we got this into the hands of a good company that would look after us. And I believe that we have done that. And I want to thank you, Karen, because if you hadn't have made that effort, I was looking for a home. I wasn't looking here. We were looking to place this product somewhere. And to come across what we have is just a blessing because if my life has been given back to my family and to live life at my optimum best, I'm not cured. I'm just living life at my optimum best every day. To have what Dr. Ahrens has provided to each and every one of us, you have a gift and you need to take it out and share. And when you understand it from the technical side of things of what it's providing you, it's life-changing. It's just, it saves lives. It saved mine.
Amen.
Thank you. Thank you for sharing that. Now y'all know we're a bunch of ball. You know we're a bunch of ball bags here because we love people. We love these stories. We know what we have. And thank you, Cathy, for sharing Sarah's story. I remember you guys on stage. I remember that story very well. And I'm not going to talk because I might cry. So thank y'all for being on. We love you guys so much. We'll be here next Tuesday night. And we're going to have some special things on Tuesday night. And I'll tell you more about that when we're closer to it. But thank you for all showing up tonight, educating yourself, getting to know what we're getting ready to launch. Not that we don't have everything powerful already, but we're getting ready to go to the next level. And I'm glad you guys are here. So good night, everybody. I love y'all so much. And thanks, Jackie. Thanks, Jamie. Thanks, Cathy. Thanks, Kendall, for sharing and helping tonight. So good night, everyone.